Working differently. Here are some highlights of the ways we've all been working differently this week. Online test prior to interview. The patient relations team had 2 vacancies they needed to recruit to. After reviewing applications, they still had 26 candidates that met their central criteria. The team were advised to ask candidates to complete a test prior to being invited to interview, to see if they had the right skills. They put together 3 tasks to complete to assess their Excel and writing skills. The candidates were given a set date and time, with 1 hour to complete the test. They were provided with a phone number to call if they had technical difficulties. Out of the 26 applicants, 16 completed the test and 12 were invited to interview. The team found the testing process and WebEx interviews to be a success, and they will definitely recruit in this way again in the future. The Virtual Joint Pain Education Group. The service was receiving a high volume of patient referrals, which was unsustainable with the current service capacity, and the service needed to be adapted to allow for the government social distancing guidance. A virtual joint pain education group was created based on NICE guidelines to help patients self-manage their hip or knee joint pain. The group hopes to empower patients to self-manage their condition and to reduce demand on face-to-face contact in the physiotherapy service. Remote Care Home Pharmacist Clinical Review. The pharmacist care home team were unable to visit homes due to restrictions, and care homes were under immense pressure due to the COVID outbreak. The team offered support with any medication-related matter through regular calls and emails. They liaised with community pharmacists, the CCG and the Trust to identify potential medication supply issues. And they created homely remedies policies for homes to support access to medication and minimise pressure on GPs and out-of-hours residents. This means that care home residents are getting access to medication in a timely way. Pressures on care home staff to resolve medication issues via the pharmacy or GP practice is reduced, and care home staff feel valued and respected. For the full case studies and more examples, please head to the Working Differently intranet page. Let us know how you've been working differently. Send us an email or use the hashtag.